topic of discussion is related to diabetic nephropathy. See, diabetic nephropathy have its own natural history, and on average it takes up to 10 years, 15 years, 20 years for the stages of diabetic nephropathy to progress and to reach an end stage renal disease, minimum 20 to 25 years on an average. But there are certain situations where diabetic nephropathy progression can be worsened or it progresses at a faster rate. What are all the commonly encountered clinical situations which can happen? As a medicine resident, you have to be aware of that in your history, and it is very important for the DM nephrology or DNB nephrology student to know this, okay, so that you won't miss the important details in the case history. First, uncontrolled sugar. A high HbA1c causes more rapid progression. Second, uncontrolled blood pressure. A very high blood pressure accelerates the progression of the kidney disease. Third, drugs. The patient taking any nephrotoxic drug on top of it. Patient is on a diabetic, some drug he is taking which is nephrotoxic, for example a painkiller, for example a heavy metal Ayurvedic medications, quack related Ayurvedic medication. I am not saying all Ayurvedic, some adulterated ones, okay. Any nephrotoxic drugs is the third one. Fourth, recurrent UTI or recurrent sepsis, because diabetic patients are prone for any infection like diabetic foot, urinary tract infection. Recurrently, if they develop recurrent insult to the kidney, the progression will be fast. Fifth, smoking. The patient who is a smoker have a high chance of rapid progression than the non-smokers. Sixth one, any glomerular condition apart from this, which is more common in the 40 to 60 age group, which usually picked by other investigation by like urine ACR, active urinary sediments. Urine ACR can be positive in diabetic nephropathy also, but the level will be rapidly rising. RBC cast or any other autoimmune manifestation. So these are all the common causes of rapid progression of diabetic nephropathy. Before the timeline, patient will jump from one stage to other, or the person might worsen and reach final stages of CKD at a faster rate. Sugars uncontrolled, a high HbA1c, uncontrolled BP, recurrent infection, drugs, any super added glomerular disease. Smoking. So clinically, if you have to see, always ask for smoking, past HbA1c, BP control. Instead of BP control, you can look at the ECG and see for LVH. That itself gives the clue. Always check the past drug history and don't mention these details in your case presentation, by which examiner knows you have knowing the theory of the particular subject you are presenting in that way. That's all. Bye bye. We will see in the next topic.